Good evening, everyone. I'm AnnMarie Cronin, and welcome to our live weekly medical radio show on News Talk 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is with us again to tell you what you need to know about how early screening and knowing your profile can lead to the avoidance of heart attack and stroke altogether. Pre-screening and simple non-invasive tests can actually prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls, so please make a note of this number, 800-859-0957. Again, that's 800-859-0957. We'll be repeating it throughout the show, but this is your chance to talk directly to the doctor. So stay tuned. We'll be right back. You're listening to News Talk 760 WJR.
We're on Facebook today.
We are on Facebook Live, and Siobhan's missing somewhere out in the middle of nowhere. Well, whatever.
We still get our followers.
That's right. Exactly. That's
all.
Unbelievable.
That's all. So, I think we'll talk today about that there's been approvals for the vaccine for young kids, which you know how I feel about that. We're not going to say that much directly on right now, but save it for the live show.
Yeah.
Yeah, so to me, that's horrible news.
Let's take out the adjective horrible. How about that?
Well, it is, but
I think the best way to approach this is to ask yourself why. Why is it important? I mean, the listeners are listening and they want to know, especially people that have, school age kids that are going to school. They're just like out to sea. They don't know whether kids should be wearing masks, whether they should be getting inoculated, whether this is something.
Problem,
you've said yourself you don't get sick from it. So what's the point? What do you care?
Well, the point is not so much what do we care. The point is that the government is making medical decisions for us, that the choice is being taken away from the parents and the kids.
They didn't ask me whether I wanted the MMR either.
Well, that one is actually worth doing. It's one of the few.
I didn't have a choice. They didn't say, do you want to? Check the box. They said you're not getting into Cranbrook. If you don't have the signed off copy, you're not getting in, so have a nice life. Or polio, or any of those other shots. Welcome back, all of your listeners, to our live weekly medical radio show here on News Talk 760 WJR. I'm AnnMarie Cronin, and we are back again tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. We are waiting patiently and looking forward to your calls. Dr. Kolender, welcome. Everything you say on the radio, the news that you give us is always up to date. It's always pertinent. It's stuff that we need to hear. We might not want to hear it, but we need to hear it. So welcome again to the show.
Thank you. Well, I thought we'd talk about a little today that we're seeing more and more vaccination approval, emergency use for children under the age of 17. And I'm going to call this unfortunate, in my opinion, because a lot of the data supports that children seem to be able to ward off the virus on their own. They have better immune systems, that they have fewer, long-term complications. And also the data supports that the vaccines just aren't that effective in kids under 17.
So is it mandatory now to get into school?
This is a path toward being mandatory.
But it's not mandatory yet.
But it's on that path. And you mentioned during the break, AnnMarie, that, we didn't have choices to get, MMR, polio. The difference between this vaccine and
Polio wasn't
those.
even around, though. It wasn't even around. It had been eradicated long before.
Well,
So,
but still, there's a difference. The difference is that these vaccines were studied for years, and we had the opportunity to study their side effects and complications for years so that we understood that they worked and that they were safe. This version of vaccine has only been around for a couple years. The virus that we're using to treat has mutated beyond recognition to where the vaccine has no real impact on what's happening to us today. And there's mountains of publicly available data showing vaccine injuries and deaths. And this isn't me pointing to the VAERS data or saying hearsay. This is in the public domain. The FDA has released data discussing, and showing how injurious this vaccine can be. So this is completely different from the history of vaccines, and giving it to kids who really have no harm from the disease, and they may have harm from the virus. They may have harm from the vaccine, is really scary. I mean, it's I'm frightened.
well, it's not mandatory yet. But before we run out of time, we've got a caller. Ashley, who's the caller? Are you with us, Greg? Are you out there?
Yeah, so you guys, okay, hey, thanks for taking my call, Mr. Positive. Hey, Dr. Kolender, AnnMarie, that's some good stuff you're talking about. Let the body work, even when you're young. But the question I have for you, surgeries in general, is it the last resort to do surgery? Number one, predicated upon infections. Number two, does oxygen make a tumor grow once you open up someone's body? And I just, people get surgeries left and right, and they just feel like they get sick or they get infections. What do you say about surgeries, my friend?
Well, thanks for calling, but that's really too broad of a question because, if you have an accident or an injury, you need surgery to repair it. If you're doing an elective surgery for cosmetic reasons, that's a choice to have cosmetic surgery. From my perspective, when we're dealing with a medical problem that's advancing toward end organ disease, surgery is the last resort. I try to do everything we can to treat something medically. From our perspective of being cardiovascular preventive experts, medical management is always better than surgery, whether it's a procedure like a stent or bypass. So there's data now supporting that aggressive medical management is as good as having a stent or having bypass for people with unstable angina. So why not just go ahead and do medical management and avoid the risk of the surgery? Because medical management is going to affect or positively affect the whole body. The surgery is only impacting the half-inch area of your arteries that are causing the flow obstruction.
But also, thanks for calling, Greg. But also, my comment here is I think that a lot of listeners are wondering what's medical management.
Well, medical management is lifestyle, medications, and identifying other conditions that cause plaque. So, in the studies, I would say they use average medical management, which is really smoking cessation, nutrition, and exercise. In my practice, medical management means looking at genetics, sleep health, oral health, medications, lipids, identifying insulin resistance, gut health. We look at a very comprehensive and broad table of data to identify other risks that need to be addressed for prevention.
Right. So let's come back and talk about that a little bit more on the other side of the break. Again, you are listening to our weekly live medical radio show where we keep you up to date on all medical solutions from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you would like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. That's 800-859-0957. You're listening to News Talk 760 WJR. And we are back on Facebook Live.
In general, his question's valid. I'm just saying it's too broad because you really have to apply it to different areas and what it means. I mean, if it's cancer,
Well, if you don't have any other choice, it resorts to, right, exactly.
I have a story we can tell during when the show comes on about how, people show up in the emergency room, they've got a pain, or something's wrong. They go show up in the ER. They get a CAT scan of their abdomen. There's a spot there. You get held overnight, and you wake up in the morning, and there's a surgeon there to cut it out. And
it's really sad. I mean, it's just really sad.
And you don't even. I mean, so if you're on Facebook, you're basically going to hear this all over again. When the show starts, but you don't even know what it is, and there's a surgeon ready to cut it out
because that's how he makes money.
Well,
that's how the hospital makes money. That's why there ought to be just national health. It works better. It works for the rest of the world. It is not working. The system here is not working for the patient. It might be working for the hospital, for the pharmaceutical companies, for some of the doctors, not working for the patient.
Well,
patients are getting scammed.
An astute patient will walk out.
Yeah,
but
let's
patient.
when most of the country's uneducated. Where's the astute patient? Most people are not doing research and doing their own.
Well, just keep your anger going because we got to talk about.
No, but I mean, it's just like I don't know.
But that happens. You walk in and here's this thing. You don't even know what it is. No one even took a chance, started to be a doctor and work it up and identify what it was and look at alternative options. So a lot of times, medical management first is better than surgery. Sometimes giving some chemotherapy.
What that is. No one knows what it is.
Well, that's why, unfortunately, when something happens, you need to get like 3-4 opinions. And, we did the shows with Hashem and...
Hashem Geyer from Flint.
He's a radiation oncologist. And so...
Smart. Very smart guy.
It's just important to make sure that you are, getting all the opinions that you need to make a decision.
Right.
And so you don't go into like a tumor that might be a cancer with, just a surgeon and an oncologist. You also need a radiation oncologist.
Well, I think you need to know what your options are. What are you coming back to?
Let's repeat it.
If you're just now joining us, I'd like to let you know that we're welcoming you to our special weekly medical radio show on News Talk 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. After 20 years in practice and watching patients die prematurely and unnecessarily, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. We're inviting listeners to call in with your questions at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, we're coming back asking you, what is the average listener who is also a consumer supposed to do?
We're still talking about Greg's question,
right.
about, what do you do with surgery? And so, I have a colleague who, had some abdominal pain, goes to an emergency room, they do a CAT scan, and she's got a mass and held overnight just because there's a mass and pain and unclear what it is. She wakes up in the morning and there's a surgeon who already booked an OR time and is telling her, hey, let's go in and get that out. And thankfully she's a doctor and knew, don't touch me. I got to figure out what it is you're taking out because it might be the wrong decision. Unfortunately, most listeners might go, yeah, let's go get it out and get me home. And sometimes
but you know why?
It's
because
they're
afraid. Because they are afraid and because of the God complex.
Well, it's bad medicine and it's taking advantage of people to just walk in and say, hey, let's take this mass out without telling the person the right thing to do. the listener should go home, if it's not an infection or something that's going to cause them to die right then and there or next week, and get some opinions. And I don't necessarily just mean another surgical opinion, but see an oncologist, radiation oncologist, depending on the area, a doctor for that area to figure out what it is you have and what's the best approaches, because you don't want to make that kind of decision on the fly. And for a surgeon to walk in the ER in the morning when you've got a mass and they've already booked an OR, that's
Right.
a sign to leave.
Mm-hmm. Yeah, but it's kind of dodgy. I mean, you have to be smart enough to know that what you have is it really truly a dangerous thing to leave? I mean, are you going to be in jeopardy if you leave? And again, we come back to the God complex. Going into a hospital, being seen by a guy with a white coat who's a surgeon with a stethoscope around his neck, telling you, "Hey, we booked an OR. You need to have this taken out." I would say 90% of the people are not going to say, "Well, why do I need to have it taken out? What is it?
Well,
What's the?"
unfortunately, that person would have probably died on the table when they didn't need to, because, and there's a lot of doctors who, the groups are in the area that I've stopped using because it feels like they already have ORs booked for every appointment.
Right.
Oh,
That's
you got a 1
unbelievable.
o'clock, I got an OR next week and all my patients are getting surgeries for this one specific specialty every time they walk in the door, and I've stopped sending there because they
Unbelievable.
don't need that many surgeries. And so in general, you want to not have surgery. You don't want the anesthesia. Then again, you have an injury, you have a orthopedic type thing. A lot of times you need it.
Well, if it's necessary,
Right,
that's the
right.
therein lies the difference. But before we run out of time, Ashley, you have a caller?
Yes, we have David calling from Windsor. David, what's your question?
Yes, my question, and I hate to burden you with that again, in regards to COVID shots. Many times, like in summer resorts, like they want you to get the COVID shot before you can attend that resort. I'm
Mhm.
speaking about the one that's north of Toronto, in the Muskokas, and any other place. And also to go to a school reunion where just about 170 miles away from here, which is around Brantford. They want you to do the same thing before you can attend a school reunion. This is getting to be a little bit far-fetched. One of these days, they're going to have to really figure out, is this really realistic about these vaccines, after I'm hearing so many reactions people can get from these things, and especially when you're healthy enough that you don't really need them. Many people have actually gotten sick from the vaccine, gotten COVID from the vaccine, and actually have passed away and what have you. What can you suggest about that?
Well, David, not a burden to take the call and answer the question. And unfortunately, the doctors who are on the FDA board making the vaccine-related decisions are also being paid by pharmaceutical companies in their day job. So their day job is to be consultants for pharmaceutical companies, and then they get handpicked to sit on the FDA, decision and advisory boards. What are they going to do? They're going to make a decision that benefits the people that pay their day job. And that is why the influence that the pharmaceutical companies have on the FDA and now, unfortunately, the CDC are overwhelmingly bad. That science is being completely ignored. And that's why I opened the show with, it's disappointing that the FDA and the CDC are going ahead with allowing vaccines to a group of people, meaning young adults, and I'm going to say young adults should be expanded to people under 40, with vaccines that really don't have a serious impact on the disease that they're treating, and vaccines that probably have major side effects based on data that's being released by the FDA itself. And the fact that this is being just ignored completely and it's being moving forward. So how do you go and visit your resort? And frankly, David, we have a camp, 3 hours north of Toronto also, that I don't know if we're going to get to because, as you know, I'm not fully vaccinated. So I just don't know how we're going to get there, and we want to go. I'm afraid to go into Canada because I don't know if I'm going to get there, if I'm going to get back.
What do you mean by you're not fully? You were vaccinated.
I'm not fully
What's
vaccinated.
fully
I'm
vaccinated?
not boosted.
So that's a requirement also that you're boosted?
This is what David's calling about, is you've got to be vaccinated. I mean, when you do these things, the assumption is you're fully vaccinated. That's what they've changed the definition of what being vaccinated is. It's not just getting your initial doses 2 years ago.
Right.
It's that you get the boosters, because we already know that those vaccines wore out, but who cares? I had COVID, and natural immunity in every study is better than any kind of vaccinated immunity. And there's countries in Africa that have had no vaccines, and they have 80% natural immunity. How many kids under 20 or under 40 even have natural immunity, and they're being mandated to get vaccines for a disease that they already have natural immunity for, with vaccines that have questionable safety data? You talk about, AnnMarie, we're consumers and we have a choice. You need to understand what your risk is of getting a disease. We know what the risk of getting polio and MMR vaccines are. Again, I'm not talking about autism and things like that. That's another conversation. But those studies, that's out there, and we have a better understanding. These vaccines are too new. They're already causing problems, and they should have been shelved with the first 30 deaths. But there's thousands of deaths, and they're still being administered. It's really horrifying.
Well, it's kind of a scary thought to think about the fact that within the younger people population, a lot of these young kids have gotten COVID, didn't know they had it because they had no. I know a lot of people whose kids got it, they tested, they had it. They weren't sick for even a day. They had no, they wouldn't have known that they got it if they weren't tested because someone else in their family got it. So if they're able to fight it off because of their own natural immunity, they're not really in danger. And especially now, this new strain of COVID is just not that dangerous, and seems like the young people are able to fight it off a lot easier. So I'm not really sure why they need to make it mandatory at all.
Exactly. Why? And you always go, well, what's the motive? And the motive is money. And the people making these decisions are being paid. Their job is from pharmacists. They make money from pharmaceutical companies. They're handpicked to sit on these boards. Handpicked.
Sad situation. Well, right now we've got to take a quick break. Again, you're listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or you have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR. Well, it's not mandatory yet.
It's on that path. This is all setting the stage for making it mandatory. This is just the path it's on. It's not, well, they're not doing it yet. They're going to do it. And the answer is, we need to, we have midterms coming, and you've got to vote out the people that are pushing these vaccine this direction, because you got to let them know this is not okay. You can't keep your job. This is a health emergency. This is the emergency. Forget the emergency use for vaccine. The emergency is stop giving us a drug that's harmful, that doesn't work.
Well, I'm not sure that it doesn't work. I just think that it's useless. It may be useless. It may not. I mean, I understand if you get the polio vaccine, polio has some dreadful side effects. And some of these diseases can certainly be very dangerous. But at this point in time,
Well, useless and doesn't work. I mean, granted, there's a difference there, but it's not much different. If efficacy is below 40%, that doesn't work. That's below any standard of care. And useless is still, why give a vaccine for a disease that doesn't need it? You're going to recover from. So all of this is known, yet it's moving forward as if it needs to be put in place. There's no common sense. No one's asking any of those questions. They're going, hey, when's the FDA going to do this faster? When are they going to do it for 5-year-olds, 4-year-olds?
I mean, isn't that already inclusive in the young people
No,
that
it's
are
like 0 to 5, 6 to 11, 12 to 17.
okay?
Each of these age groups is getting its own, attention. But they're all basically the same, meaning just as this, they don't need it, they don't get sick, they don't die. To say that you should give the vaccine to people who are chronically ill and at higher risk, great. But that's a decision between the patient and the doctor, not
Right.
a decision. This is the difference between, let's come back to this. This is population medicine versus personalized medicine. This is the harm of population medicine.
Well, population medicine is just the doctors, joining practices that give you 5 minutes, blow you in and blow you out. But if it becomes a government
But this is
mandate,
cookie cutter medicine. Everyone gets this vaccine.
I understand. But if you're prevented from going somewhere, just like our first caller wanted to know about being restricted from going here or going there. If you're prevented from going to school because you didn't get a vaccine, that's like serious. That's very serious.
Well, especially like you said, when it's useless. Now, there's other schools in other states that aren't requiring
So this is a
this
state
being
by
done.
state thing.
Often
So this mandate's going to be a state by state thing.
it isn't, but it has been. Different states have
so
different. You're
ridiculous.
right, it is ridiculous.
Why do they call it the United States of America? There's nothing united about
No,
it.
we're becoming federalists.
Oh my God. Okay, well, we're coming back to discuss population medicine. Welcome back to our special live medical broadcast on News Talk 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about two important topics, prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, let's come back to our discussion about the mandate for vaccines on young people and talk to us a little bit about population medicine.
Well, these are decisions that are being put out to everybody to protect a few. And there's no question that people who are at high risk should be candidates for getting the vaccine, knowing what we know now. Now, what we knew in 2020, 2021, different story. We had a new virus. People were dying left and right. Hospital ICUs are filled. They're running out of ventilators. Another problem. And then vaccines were probably keeping people alive. But now we've had the vaccines mutate, and they no longer
Would the virus mutate?
Thank you. The virus has mutated. We really have, it's a totally different disease. It's basically a common cold.
Right.
Granted, it's a common cold that you can get over and over and over again because it keeps changing, and we don't get as immune to Omicron BA as to BA2, but it still is just a cold that you get over. And whether or not it causes long COVID or not, I think we don't know. But we do know that these vaccines are really not helping anybody not get Omicron, not necessarily keeping them out of the hospital. I think the biggest problem still with hospitalizations is lack of access to care. If you don't have a doctor and you don't have anyone to call to explain what your symptoms are, well, then you're going to go to the hospital. And then you're getting treatments that are totally ineffective, like remdesivir and things like that.
Yeah, I mean, it's a sad situation to be in, but what do we do about it?
Well, you got to vote. I hate to say it. It sounds terrible, and everyone feels like their vote doesn't count, but you still have to vote, and you have to know which one of your representatives and which of your senators are supporting getting vaccines, and vote them out and let them know this is not okay. And granted, we don't have any say over the FDA because they're not elected, and the FDA can hand pick who they want to sit on which board to recommend how a vaccine is being administered under emergency use. There is no emergency for kids under 17.
Well, we're getting to the end of the school year right now. We're going into summer vacation. We've got the summer off. We're not going to really have to worry about this until it comes to September and then going back to re-enroll in school. But I just can't even imagine how they can make it mandatory. I mean, that's kind of, it's a huge problem because does that mean that people are not going to be allowed to come back to school if they don't get the vaccine?
Well, it's obviously a problem to get your education stunted because you can't get into school. But from a health perspective, you're getting a treatment that is, in your words, useless, in my words, ineffective, and possibly harmful.
Right.
That's against the Hippocratic Oath. Do no
Right.
harm. Our entire FDA has broken their vows.
Mm-hmm.
When we're talking about this is a population medicine problem, these are the things that are going against us
Mm-hmm.
when we want to just work on prevention of chronic illness.
Mm-hmm.
These are the forces going against us. COVID is just a great example of shine the light on how all this is about driving money to pharma and to surgeries. Treating end-stage disease and getting a pharmaceutical product out there. Doctors and research about identifying earlier disease isn't really about preventing disease. It's about finding earlier opportunities to intervene with a procedure or finding some pathway for a pharmaceutical company to come in.
Right.
It's not about identifying opportunities to change lifestyle, educate people, and apply a more holistic approach. It's about getting pharma products out.
Unfortunately, what you're just talking about there is access to medical care, which is very paltry right now at this time in this country. But anyway, Ashley, you have a caller.
Yes, we have Jesse calling from Richmond. Jesse, what's your question?
My question is for the doctor's thoughts on keto and carnivore. I've been leaning a little more toward keto just over a year now, eating more fat than I ever have, and my cardiac risk is lower than it's ever been. And I'm considering not going full carnivore, but more like, I guess, what they're calling ketovore. It seems to be it makes a lot of sense on paper and logically, and I know they've done some studies, and it's supposedly curing a lot of people's chronic diseases.
Oh,
So
good.
I'm just curious for your thoughts on that.
Well, how are you measuring your cardiac risk? What data are you following to say I'm a carnivore and my cardiac risk is going down?
My physical examination paperwork from my PCP, been tracking things for years now, and I just had my last physical in March, and all my numbers were great. And according to their statistics on their, the physical from the fasting blood test results, my cardiac risk is lower than it's ever been.
So unfortunately, that cardiac risk calculator is what's being used to gauge how we prevent disease in people. The bottom line is it tells you whether or not you should be on a statin, whether you should be on a medium strength or a high strength statin. And that's what that calculator is for. And using that calculator, the number of deaths in America have gone from 600,000 a year to 650,000.
700,000.
Now it's up to 700,000. So the calculator that you're using to decide your risk is actually broken. It doesn't decide risk because more and more deaths are happening in America from cardiovascular events, specifically heart attack.
Right, and I don't trust their, and I know the numbers have to be viewed on a certain, outlook, and I definitely don't trust my PCP in general to care about my health as far as preventing it.
Well, but
So,
that's what you just said. You just said your PCP gave you the data that you've been following for years using the risk calculator, and based on that, you feel like you've been lowering your risk on the diet that you're on. Unfortunately, that data doesn't identify risk. So the people that are doing real research on prevention are all pointing toward a more heavily plant-based diet. And this is scientific research. Humans do not need a lot of protein to live. Granted, keto or high-fat diets, staying away from sugar, can help you lose weight quickly, but then for most people that are doing it, it becomes an atherogenic diet. And you just don't have the data. You need to look at your arteries, measure your CIMT, get vascular inflammation markers, which you're just not doing with your PCP. No one in my practice is on a keto diet, and they're not on a carnivore diet. Nobody.
What's an arthrogenic diet?
Diet that promotes plaque production.
I see.
Yeah, no one's doing that. There's no data supporting long-term data supporting high-fat diets for prevention. It doesn't exist because it doesn't work.
It's amazing how this caught on, though, because I've heard of a lot of people that go on this keto diet and they think it's the be-all and end-all, but
Well, it's appealing
sounded
because you
stupid
will
to me.
lose weight quickly.
whoop-de-doo. What
Right,
does it matter if you
whoop-de-doo.
die of a heart attack?
Yeah.
I mean, come
Well,
on.
What no one knows is that Atkins, who did the Atkins diet, which is a high-fat diet, he died of heart failure and kidney failure at like age 72.
Oh, my gosh.
They put out a rumor that he got hit by a brick falling off his building in the winter. But really, he died of the diseases he thought he was preventing. The diet doesn't work.
Yeah, I don't think keto's up to much either. Anyway, in the meantime, we've got to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subjects we're discussing tonight and you would like to talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR. Back on Facebook. This keto diet is so out of control.
Well,
I've
it's
known so-
appealing. It's really
What's appealing about keto?
well.
Tell
You
me
don't
what I'm missing here.
you don't eat protein, but for
What do you mean I don't eat fish as
you eat
protein?
fish, but that's
Eggs
it.
are protein.
That's it.
Cheese
That's
is
it, though.
protein.
But for people that eat chicken and they want to eat red meat and bacon, it's very appealing to get told you can eat all these things and pretty much as you want, and that's okay.
It's not just the people that I know that are on this diet. It's not just eat as much as you want. It's eat to excess.
Well, that was Atkins.
No,
now
this is
there's
the people I know that are on keto.
well, then they might be, but there's so many versions. I mean, to be honest, who's heard of carnivore diet? I mean, what's the difference between keto and carnivore diet? 3 ounces of protein. You only eat protein. That's a colon cancer diet.
Exactly.
It's a colon cancer
So
diet.
why is there not a caveat on that it is a colon cancer diet?
Well, because on social media, which is all everyone gets their information from, that's all you hear. So if it's appealing to listen to that, to hear, oh, I can eat that, I can have a bacon burger every day, as long as I don't eat the bun. If that's what you want to hear, it's on social media and the internet to say that's okay.
Irresponsibility of the doctor.
And there's no way that guy's triglycerides are normal. There's just no way.
He doesn't know it, though, because did you hear how mesmerized he was about the fact that all my blood work, I just was laughing while he was talking. All my blood work came back fabulous. What kind of blood work? Mickey Mouse blood work?
Well, we don't know. And he started the conversation like he's informed, and then it quickly went to, oh, my blood work.
But
Meaning, I don't know what my blood work is.
But that's the point of him thinking he's informed. When they go in to see their doctor and they get these Mickey Mouse blood tests, and they maybe get sent for a stress test, and maybe they get an EKG done, they're mesmerized by that. And they think, oh, I'm home free. There's nothing wrong with me. I'm good. And I can just keep on with this keto diet and keep on eating all these hamburgers ad infinitum and all this protein ad infinitum. And I think it's a dangerous diet.
Oh, it's terrible. It's not healthy. It causes plaque. It causes diabetes, even though you're not even sugar, because if you have insulin resistance, too much fat and protein turns into sugar. Your liver can't metabolize it. So it just all backfires, and you might be a little thinner, but you're going to be sicker. And true, the current labs that you get from your doctor, the Mickey Mouse stuff we talk about, that may look okay, but it's not telling the whole story. And that's why our healthcare system's broken. Those labs mean nothing.
I mean, it's a shame that he's just like the average Joe Q public that is just mesmerized by their doctor, who they go in and they get this 5-minute.
Well, he went from I'm in favor of, I've got the data from my doctor I've been seeing for years that he's been collecting, to I don't trust my doctor and I don't know really what the data is.
Am I coming back to the final segment?
Yeah, it is a final segment.
I'm coming back
Whether
to.
you like it or not.
Oh, I don't know what happened to segment 4, but okay.
We just did it.
We did it? Okay.
Yeah.
You're right. Welcome back to the final segment of our special weekly live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that number is 800-859-0957. And once again, I'm asking you to tune in to our Dr. Kolender Sunday show, Sundays at 3 p.m. for more information. So, Dr. Kolender, we just had a caller that's, mesmerized by this keto diet, which, as you said, it causes plaque. I think people need to know that.
The problem in this country with healthcare is that the doctors don't have time to give you any nutrition or lifestyle recommendations, period, in 5 minutes. So everyone's on their own to get their own information, and they're on social media and they're on the internet, which is, of course, garbage. And whoever's selling something, whoever's something to sell, they're on social media. And if they're appealing to your sensibility, you're going to go that way. If you want to eat a lot of protein, well, then there's someone online giving you a diet that sounds good to you. Unfortunately, the people doing long-term research are coming up with different things entirely, which is we really should be mostly eating plant-based. There's a lot of diet doctors out there who are arguing over a few ounces of protein. I mean, there's how many books out there about what to eat? And basically they're the same book, which is eat a lot of vegetables. And they're arguing again over a couple ounces of protein. And what's okay and what isn't okay, or don't eat any protein or that. In general, if you are eating a clean, healthy diet, and what that means to me is mostly plant-based, organic. You want to know where your food's coming from, because the pesticides cause gut dysbiosis. It causes injury to your lining. It causes insulin resistance. It causes unbalances your hormones. All of those things are caused by chemicals in our food and synthetic hormones in our animals. And you want to have clean whatever it is.
Once again, I'm really surprised that the patients who have doctors and the doctors are not counseling them on the dangers of these types of diets, which are basically useless and can cause disease. But I'll get off my soapbox because Ashley has a caller.
Yes, we have Bob calling from Detroit. Bob, what's your question?
I'd like to know some information about Parkinson's disease. I was recently, last spring, I was saying, doctor said I had Parkinson's, so I was recently told I had Parkinson's.
Well, Bob, thanks for calling, and sorry to hear about that. From a preventive aspect, Parkinson's is considered type 3 diabetes to preventive doctors. So, type 1 is generally juvenile onset diabetes. It's mediated by an autoimmune condition where you develop antibodies to your pancreas. Adult onset type 2 diabetes is more genetic, or epigenetic is what I would say, and is environmentally induced. Most of us are people out there have type 2 diabetes. It's driven by insulin resistance. From my perspective, insulin resistance can also cause Parkinson's. So whereas Parkinson's is just another way of chronic inflammation to present itself if you're predisposed to that way. So I'm guessing that whether or not you have diabetes, you have insulin resistance. So you may not have been diagnosed per se with diabetes, but you have all of the markers of insulin resistance that we talk about on the show all the time. High triglycerides, low HDL, number one, high non-HDL cholesterol numbers. These are signs that you can look at as someone who's has insulin resistance. You're on, or maybe you've been told you're pre-diabetic. It's all the same thing. It drives Parkinson's. So, movement is the most important thing for you to do. There's classes about boxing. There's a company, it's a nonprofit called Rock Steady, and they have boxing gyms all over the place. They're all over Michigan too. You can go and sign up, and so boxing skills actually help you a lot with Parkinson's. So I would recommend going and finding a Rock Steady class near where you are.
Good information, but as you're talking to this caller, I'm wondering to myself, how in God's name did his doctor let him get to this stage? Because if Parkinson's is indeed stage 3 diabetes, or whatever you classified it as, and we talk about the fact that diabetes can be prevented and avoided, what happened to the doctor that saw him 15 or 20 years ago?
They're just not looking at it.
Why not?
Well, because the system's broken and doctors aren't doing what they're supposed to be doing anymore. The people are driven by what they can prescribe a drug for, what the FDA calls a disease. And they really haven't established insulin resistance as a disease that you can prescribe medication for, because it would cause too many people to get medication. Insurance companies would go broke filling scripts and paying for pharma products for insulin resistance. They're the same drugs that you use to treat diabetes. So it requires somebody who recognizes insulin resistance, which could be any doctor, and spending the time to educate somebody. I mean, I don't think that I knew 10 years ago that insulin resistance caused Parkinson's. This is still kind of new. But so unfortunately, once you have Parkinson's, you have it. You've lost cells. You have an end-stage disease. This is for the listeners who are pre-diabetic or have insulin resistance, who have high triglycerides, recognizing this is a condition that you may never become diabetic, but you're going to develop Parkinson's or some other neurodegenerative disease. Maybe it'll be MS, or maybe it'll be ALS, even though they're a lot less common. You just don't know. It could be dementia. I mean, insulin resistance definitely contributes to dementia. So making the hard choices to eat healthier now are going to pay off down the road. And you've just got to know that that's why you're doing it.
Well, he already has the disease, so I'm just wondering where the doctors were that he was in the care of, whatever doctors before that let him walk down this road, walk down this journey. And like you said, you didn't know what insulin resistance was, but now I guess every doctor knows what it is.
A lot of this is, I know they don't. They really don't.
That's not good news.
They know what, they may know what it is in general, but they don't know to look for it earlier. They don't know to talk to their patients about it. I mean, after insulin resistance is like, again, these are random data points and random things to say, but you may say you're insulin resistant, then you're pre-diabetic. They're still not treating people for pre-diabetes. They're still not giving them a hardcore discussion about lifestyle and exercise to help reduce insulin resistance and the chance of turning back diabetes, or using hormones to improve your body's metabolism so you don't become diabetic. They're not talking about that because there's no drug for it. When you're diabetic, now here's a garbage pill, metformin, that doesn't really do anything. And then they're on metformin for a while.
It's a sad story, but it just, again, makes me think that every patient has to be their own advocate. Find a doctor that specializes in prevention so they don't get these deadly diseases. Well, unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Please continue to tune in to our shows Sunday afternoon at 3, Thursday evening at 7 p.m. for the latest medical updates. And thanks for listening to News Talk 760 WJR. Good night and be well.